Hi, this is Martin Nicholas. I want to give you some examples of how Scribe can be used with eCW. After I do this video, I'll make some videos showing how I integrate Dragon, but I've found that using Dragon templates and using Scribe together can create a very powerful tool for your dictations that can really make things nice and quick and a whole lot easier than clicking separately on everything. So I've just created a bunch of test patients here. We're going to pick one, and you just start from your schedule screen the way you typically would. You do need to make sure that Scribe is enabled and that you have your subscription all set for that. So you click on this top Scribe button, and you end up with this split screen. This center over here is your regular progress note screen that you would see anytime you're using eCW, and you can do your usual thing the way you always do here, clicking and doing your regular notes. However, what's different is the left side, which is the Scribe window. This is the window in which you can dictate free text, and then by using this Scribe It button here, you can transfer that free text into structured data for your notes. So I'm first just going to give you a couple examples, and then in further videos I'll get down to the real nitty-gritty, but I think you'll be impressed at how quick and easy it can be once you have everything set up. So let's say I have this patient, Mary, who is coming in for a follow-up of her hypertension and hyperlipidemia. She just had lab work done. This all stuff is in the computer from previous visits, obviously, and we'll just go from there. So I'll start by I have my Dragon screen up here, and I'm going to dictate using Dragon Power Mic. HPI. The patient is a 35-year-old woman presenting for a routine follow-up of her hypertension and hyperlipidemia, period. She's doing well and is taking all of her medications as directed, period. She has no complaints today, period. She did have lab work done recently, period. Her LDL was above goal at 170, period. She states she is following a low-fat, low cholesterol diet, period. She has tried taking simvastatin in the past, but had severe muscle aches, period. She otherwise is doing well and has no acute complaints, period. Next line. Medical history, hypertension, hyperlipidemia. Social history, she does not smoke and she does not drink alcohol, period. She's eating a healthy diet and is exercising at least 5 times a week, period. Family history, father died of an MI at age 48. Dragon Normal Review of Systems. Dragon Normal Exam. Accept defaults. Her cholesterol is above goal given her risk factors of hypertension and a strong family history of coronary artery disease, period. She cannot tolerate statins, period. I've recommended starting Zetia at 10 milligrams a day, period. Repeat labs in 6 weeks, period. Follow up with me in the office in 3 months, period. Her blood pressure is under very good control, period. Continue her diltiazem, period. Follow up in 3 months, period. Okay, I've turned off my Dragon mic here. I'm going to get rid of this because we don't obviously want to be using ICD-9 anymore. Now that I've completed this dictation in just a normal way, I'm going to hit the Scribe It button, and you can see this working, and it's going to transfer over all my data. And so if we switch back to the full screen here, we can see that very nicely that whole dictation has flipped right into structured data. The HPI is here, the medical history is where it should be, the social history is here. What's even neat is that because I said her father died of an MI, it has kicked it into her father being deceased in our little chart over here. So the program is smart enough to figure that out, which is nice. It saves you some work. Review systems has gone in, her physical exam has gone in, the assessment's gone in, and everything's there. Now typically when I'm in a patient exam room, I do the treatment while I'm in there. This is a fake patient obviously, so I haven't done that, but I would already have added the Zetia and everything like that. So you can see this is really very, very quick and easy. Let me show you another example of how quick this could be by using a Dragon template. So we'll pick another fake patient. We'll pick Kate here, and let's say Kate is coming in for a typical uncomplicated urinary tract infection. We'll pretend that the MA has already seen her and has done her vitals and has put in the urinalysis, which is positive. Dragon UTI template. "29-year-old woman, 2 days. No. No. Bactrim DS 1PO BID for 3 days. Scribe it." Now you have to admit that's pretty incredible and fast. So because I had that template set up for what's a very quick, easy visit, all I had to do was basically dictate her age, the duration of her dysuria, and what I gave her for her medication, and we're done. So in further videos, I will show you how to make some of these templates and get a little bit more into the nitty-gritty of how you can work with Scribe and Dragon together.